Hi everyone, welcome to a special edition of the Dysmenorrhea Project podcast episode 5, Pain's Paradox, Finding Strength in Struggle. I'm Jacqueline, your solo host for today. As a medical student passionate about women's health, I usually share this platform with my co-host Sangavi, but in this unique episode, I'll be taking you through our journey into this often underrated side of medicine. In today's podcast, we'll be discussing fibromyalgia, a condition deeply associated with chronic pain. I'll be going through the basics about the condition, signs and symptoms related to this, alongside what the prognosis and management plans are. I'm also excited to introduce Hazel, who is part of the team at the head office of Fibromyalgia Action UK, to come talk to us about her experiences in the second half of this episode, so stay tuned for that. So, fibromyalgia is a long-term condition that brings widespread pain and tenderness all over the body, along with fatigue and sleep difficulties. It's a bit of a mystery to scientists. They're still figuring out exactly why it happens, but it seems like those with fibromyalgia feel more pain than others. Unfortunately, there's no cure for fibromyalgia yet, but there are some ways to ease the symptoms. So just a little bit about the epidemiology and the prognosis for this condition. It actually affects anyone, but it's more common in women than men. While it can develop at any age, even in children, it most commonly starts during the middle age, so people of all races and ethnicities can actually be affected by it. So the prognosis for this actually varies from person to person. It's more like a chronic condition with no available sort of cure at the moment. And many actually manage their symptoms effectively, and that can sort of fluctuate or be quite steady for the symptoms. An early diagnosis actually improves prognosis in terms of like the progression of the disease, and treatment actually involves with medical and lifestyle changes, and most actually can lead with an active and productive life. So causes and risk factors for this. So genetically, there are some people that are more likely to be affected than others because of their inheritance of the condition from their parents. However, it's also important to note that it can still occur in individuals without a family history of the condition. And there are also some triggers for fibromyalgia, and usually it's by a stressful event. This might be a physically stressful event or an emotionally stressful event. So some possible triggers of fibromyalgia can be an injury, a viral infection, giving birth, an operation, a breakdown of a relationship, being an abusive relationship as well, and also a death of a loved one. Sometimes there isn't an obvious trigger, however. Some signs and symptoms for fibromyalgia. So it's a chronic condition, so usually it's a widespread pain throughout the body or at multiple sites. The pain is often felt in the arms, the legs, head, chest, abdomen, so your stomach area, your back and your buttocks. And people often describe it as an aching, burning or throbbing pain. And fatigue or an overwhelming feeling, usually, and a feeling of like being tired, trouble sleeping, and other symptoms can include muscle and joint stiffness, tenderness to touch, any sort of numbness or tingling in the arms and legs, and problems with concentrating, thinking clearly, so affecting your cognitive function, and having heightened sensitivity, so being very sensitive to light, noise, maybe smell, and also temperature. And lastly, you can have sort of like digestive system issues, such as bloating or constipation. So the diagnosis and treatment for this condition can be quite difficult because there's no sort of specific test at the moment to diagnose fibromyalgia, and the symptoms can also vary a lot depending on the person. So your GP, for example, will have to rule out like any other possible diagnosis first before they diagnose you with a specific condition like fibromyalgia. So they might check for swollen joints, for example, that might suggest like inflammation of the joints called arthritis rather than being fibromyalgia, because sort of joint inflammation can also cause pain, maybe at multiple sites of the joint, so people might get mistaken that's is something else. And tests to also check for some conditions, including like urine or blood tests, can also be used. And also any scans like x-rays can be used to diagnose as well. So what's the actual criteria for diagnosing fibromyalgia? Is that if you have pain in multiple areas of your body, if you have the symptoms that we've mentioned earlier, and it stayed at least a similar level for at least 3 months, if the symptoms can't be explained for any other reason, if you feel unrefreshed after sleeping or have problems thinking or remembering, so that suggests like cognitive difficulties, and experiencing like extreme fatigue or tiredness, which may indicate fibromyalgia. So the main 3 treatments recommended for fibromyalgia is currently sort of exercise, and that might be prescribed by a GP. So regular exercise is shown to reduce pain and improve your quality of life. You can have talking therapy, so acceptance and commitment therapy, ACT as short, where you learn to accept what is out of your control and commit to making changes that will improve your life. And also cognitive behavioral therapy is under this as well, so CBT, and it's basically a talking therapy that can help you manage your problems by changing the way you think and behave. So some medications like antidepressants can help people with fibromyalgia, because it can treat like relief pain and also treat the sleep problems. It doesn't have to be prescribed with depression, so it's not really directly related to that, and you don't need to have depression to be prescribed with antidepressants, as like a side note. And usually this is for people that's aged 18 or over for medicine treatment. And there can also be like group support, so also like physiotherapists and psychologists helping sort of specialist treatment to develop some coping strategies and manage your activity levels. And lastly are alternative therapies like acupuncture and massage therapy that can be used as well. So now we have a better understanding of fibromyalgia, let's hear from our guest speaker Hazel, and which will talk about sort of more in depth into the fibromyalgia patient side of things. Hi everyone, so now this is our interview section of our podcast. So we have Hazel, who has kindly accepted our invitation to be in our podcast today and just share her experiences. So Hazel, could you introduce yourself to our audience and just have a brief description of your background?
Yeah, hi, my name's Hazel Borland. I'm here today speaking about having fibromyalgia. I've had fibromyalgia myself for 30 years. Started at the birth of my daughter, and unfortunately she's also got fibromyalgia too. So there's my personal experience with fibromyalgia. I volunteered with Fibromyalgia UK. Sorry, FMA UK for short. It started off as a volunteer and then became a paid employee with them. And I've been with them now since about 2010, doing both. So quite a bit of a background in fibromyalgia, as I say, from both personal and work experience.
So what's your understanding of fibromyalgia? So for example, for people who actually don't really know what the condition is, and I think you said like you were diagnosed with it early on, right? That you found out.
It took me about 12 years to get a diagnosis.
Yeah.
So it's quite a long length of time. Thankfully, it doesn't take as long for most people nowadays. Fibromyalgia, a lot of people hear it and think it is just a pain condition. They think, oh, it's a bit of pain. And I think one of the biggest things for me was finding out that it wasn't just the pain. There's a lot of other things going on alongside the pain. So the main symptoms are widespread pain affection of the entire body. Fatigue, which can be really quite disabling fatigue at times. It's as if someone has just pulled the plug on you and your energy levels just go completely. Unrefreshing sleep. So even if you just get a good night's sleep, you wake up the next morning, you feel just as tired. So you don't ever get over that feeling of tired. And cognitive dysfunction, it's often called fibro fog or brain fog. And that's like short-term memory loss, mixing up your words, forgetting words, just lack of concentration, lack of focus. So just anything sort of cognitive. That's the sort of main symptoms. But also you can get oversensitivity to light, to sound, to smells, IBS problems.
So how has that affected your daily life in general?
Sorry, well, and again, this is one of my fibromyalgia symptoms. Is a bit of a cough and a bit of a affects my voice sometimes. It's had a big impact on my life. From I wake up in the morning, I've got to take medications before I even think about getting out of bed. Things like getting up, getting washed, getting dressed, getting out the door. We've got to plan all that on ahead and look at what you're doing. That affects my ability to work. I only work part-time. Affects family life, so I've got to, if I'm going out somewhere or a family event, you've got to plan ahead. Got to plan and invest time before doing things, invest time after doing it. Often have to cancel short notice or change plans around at the last minute. So just really, it impacts everything you do from when you wake up in the morning till you go to bed. Things like, even just things like doing the housework. If I want to hoover, I can't hoover a full room in one go. So I might hoover half of them, sit down, have a rest, and then hoover the second half. I might hoover one room one day, but need to do another room another day. Things like the brain fog and things like you can put things in the wrong places. So things that should be in the cupboard I'll find in the fridge.
And what sort of are your experiences with getting a diagnosis in the first place?
For myself, it was quite a long, drawn-out journey. I think it took me about 12 years to get a diagnosis. Because my symptoms started just after giving birth. Initially, I was told, oh, you've just had a baby, it's childbirth. My pain at the beginning was mainly my lower back. So again, it's the same, just put down childbirth. I also had postnatal depression. So a lot of the time I was getting told, oh, once that passes, you'll feel a bit better. Give yourself a few months and you'll feel better. However, after a few months, I felt worse. I was getting more symptoms. I was getting pain in different parts of my body, totally unconnected to my back. And what really confused me was the pain would move. So I would get pain, it might be my legs one day, but the next day it might be my arms, and the fatigue was terrible. And I kept getting told, oh, you've got a young baby, you're up during the night, you're doing night feed, you should expect to be tired. But I had friends who had babies at the same time, and they all seemed to be moving on and getting on with life, whereas I seemed to be struggling more. My daughter was 2, her husband actually gave up work to look after both of us. It was just too much, him being out at work, then having to come in and sort of take over the household. So we passed backwards and forwards, various doctors. I get told I had psoriatic arthritis. They said no. Then it could be zero negative arthritis. No, we don't think it's that. Frequently told it was all in my head and it was my depression. I just needed to get back to work and be out and meeting people, and I'd gotten better. So when I did eventually get the diagnosis after 12 years, it was a big relief to actually have a name and have something to actually say, oh, this is what it is, and to know what I was dealing with.
It's been quite a journey listening to your diagnosis story, really, because it's like, oh, is it that one? And then, oh, no, it's not. So it's just been lots of confusion, isn't it?
It is, and it's still the same for people with fibromyalgia getting a diagnosis. There's not any test that tells you what it is. So they'll do blood tests, they'll do x-rays, etc. to rule out everything else. that might be causing the symptoms. And what's often most frustrating for people is they'll come back and they'll tell you, oh, don't worry, your tests were clear, your tests were normal, but you still don't have any answers to what is happening and what's going on.
There's no like direct way of diagnosing this condition at the moment because of so many complications it can have. So what are like the treatments that you've done?
At the moment, I'm on a combination. I've been fortunate. I'm on medication that works for me, although it took me about 18 years to actually get that combination right. So the medication I'm on, it doesn't take away the pain completely, but it helps to reduce the intensity of the pain enough that allows me to sort of function on a daily basis. So that's my sort of first line of sort of defence against the symptoms is a medication. I then use a lot of self-management techniques. So pacing works for me, as I mentioned earlier. I've got to pace my activities. I've got to plan ahead and make sure I don't do too much at the one time. And I get plenty of rest in between. So pacing, keeping active, keeping moving. I don't do any specific exercise routines, but I do a lot of stretching during the day. I try and keep walking as much as I can, keep moving during the day, just so that I don't get stiff from being in one position for too long. For example, sitting doing this, I know that when I'm finished, I'm going to be hardly able to move off the chair, but I'll get up and I'll do some stretches and exercises and just move about the house a bit, just to get moving, because I know that will help ease my pain. I use holistic therapies, mindfulness meditation, I've got a weighted blanket, stuff like that. I use supplements. Often I'll just distract myself. It's that way, but if you're doing something you enjoy, it takes your mind off the pain. And I love to craft and to crochet and colour in, so it might just be doing something like that, even for half an hour.
Like hobbies as well, like that takes your mind off things. That's just an easier way to stress relief as well, really. And we chatted earlier on about sort of your experiences, obviously, before recording this podcast, and taking a little detour from hearing about patients' perspective, because we've done that for a few of our episodes currently. Hazel also has like a really unique insight about also being a carer for one of her family members. So would you mind discussing a little bit more about your role as a carer in your family?
No, as I say, my daughter also unfortunately ended up with fibromyalgia. We had a catheter when she was 14. And she ended up, she was about 16 when the symptoms started to really become noticeable. And at the beginning, she wasn't having constant pain, but she was taking what we call flare-ups, where the pain would flare up. It can flare up just for a few days or a few weeks and then settle back down. So her symptoms would flare up and then settle. And our GP would insist that it was actually just viral infection she was taking. But it turned out, no, it was fibromyalgia. She got diagnosed when she was 18. So by the time she was diagnosed, she was sort of getting just fairly independent. She left school, she was at college. So a lot of my caring role was to do with being mental, emotional, just psychological support, just to help her to sort of keep doing what she was doing, try and help support her to keep in college and different things like that. But there was also the sort of the physical sort of care needs. So if she was having a bad flare, might not be able to get out of her bed, so would need help with meals being made for her, just help her generally. Sometimes actually have to help her get up out of bed, get to the toilet, things like that, even in a bad flare. So she's out of the house now. She's got her own place. She lives with her fiance and her stepdaughter. And her fiance's actually also got fibromyalgia, so we keep it in the family. But yeah. So even now she's out of the house, still a lot of support there and a lot of just providing that general help when it's needed.
Mm-hmm.
And it was just being there for whatever she needed, just helping her. I just make sure that she was okay. I found it quite difficult watching her struggle.
I can imagine. And obviously you also struggle with fibromyalgia and have been trying to cope with all these years. How are you trying to balance all of this, like being a carer and also suffering the same condition yourself?
I think, obviously, I knew what she was going through. And so just being there to support her and to understand what she was going through, because I know through my work experience, talking to others with fibromyalgia, a lot of people don't have that family support. So there's a lot of people who are struggling, but families don't believe them that their pain's as bad as they say it is, or they think they're just being lazy because they're not doing things. So I think just being there to support her and to try and encourage her just to keep doing things as much as normal. As I say, I found it really difficult seeing her struggle, and I think part of that's just being a mum thing, where you don't want to see your child, no matter what age they are, struggling and in difficulty. So it was just that feeling helpless at times, that I couldn't do more and want to take away her pain. And I think especially when I got a sort of pain medication and pain management system that was working for me, things that work for me don't work for her. So it was difficult. I wanted to find something that worked for her as well. So, but yeah, we always just sort of muddled along. If both of us were flared up at the same time, unfortunately, it fell to my husband to look after both of us. And if I with somewhere, we always just sort of we'll muddle along and just do what we can and sort of focus on the priorities.
I guess you have an advantage of having like a better mutual understanding with your daughter then, because when she has flare-ups, for example, you better understand that and like can relate to that a bit more than like maybe some other families. So in terms of your role in FMA UK, and obviously you mentioned that in your little introduction to yourself, could you tell us more about that, and sort of how does that involve like advocating for fibromyalgia patients?
As I say, I started off first involved with FMA UK roughly maybe about 2009, 2010, and started off, I met Des, who's the chair of FMA UK now, at a support group meeting. I went along to get support myself, and through meeting him, I started volunteering, helping out with some admin work from home, and also helped the foundation set up our local support group in the Paisley area. So I was doing volunteering for a couple of years, and then Des has got his own business, so I started going into his office and just doing a couple hours a week, helping out, doing admin work at his office. And then the charity moved their head office up to Scotland, up to Paisley, December 2012, and I get the opportunity to take on the role as a paid office admin. So I do all the general admin side of the charity, answering emails, answering the phone, managing volunteers, admin type work, but also alongside that, I've also done awareness talks. I do a lot of awareness talks and presentations to businesses and organisations and other groups, things like this where I'm talking online. So yeah, taking part in meetings where I'm representing people with fibromyalgia. I'm involved with the chronic pain working group of the Scottish Parliament, taking part in research projects. So a lot of different things. It's a very sort of varied job. But just anything really the general admin of the charity is sort of my main role.
Yeah. So after sort of participating in your admin role or general role in FMA UK, did that influence your perspective towards like the support you can get, or for fibromyalgia patients in general, like any support or advocacy in that way?
Yeah, I think so. I think it helped. I was always very lucky that I had a good family support network right from the start.
Mm-hmm.
But I think it also made me realise just that that's not the case for everyone.
Yeah.
So it gave me that sort of wider perspective and how varied fibromyalgia can affect someone.
Mm.
You can meet someone who only has mild symptoms, and having fibromyalgia only has a slight impact on their day-to-day business. They may be still able to work full time, or they're still able to do all this sort of family stuff, hobbies, interests. But then at the other end of the scale, you might have someone who's either housebound or even bedbound, and whose symptoms are so severe that they need carers coming in, and that they're basically, it completely takes over their life. But it's gave me that sort of perspective and just how varied it can affect someone. Also, the fact that medication doesn't work for everyone.
Mm-hmm.
There's not one particular medication that helps people with fibromyalgia, so it can very much trial and error. And also, there's a lot of stigma and disbelief around fibromyalgia, even within the medical profession, let alone in public. Yeah. So I think it's also trying to raise awareness as much as I can about the condition. Even though there's not a test, it doesn't mean that it's not genuine.
I think this relates nicely into the next section about sort of educating about like fibromyalgia in general to the wider public, because at the start of our episode we did talk about some of the symptoms related to this condition, but I think just reading about a condition or a disease is not enough to actually understand it, compared to maybe speaking to somebody or actually empathizing towards like, you know, how hard that makes your life to become. So in terms of like the misconceptions you talked about, can you expand more on that? Like what specific ones have you encountered?
One of the biggest ones is it's all in your head. Because as I mentioned earlier, fibromyalgia pain, one of the things that confused me at the beginning was the pain moved about. Now, this is because fibromyalgia's pain, not due to any injury or disease or any inflammation in the body, it's actually due to the central nervous system becoming sensitized and oversensitive, and it's the pain signals that become disordered. I often describe it as a wonky pain signal. It's like, often use an example, when you stub your toe, your brain tells you it's sore, but 2 seconds later you've forgotten that that's sore because the pain's gone away. But with fibromyalgia, you stub your toe and your brain goes into overdrive and keeps sending you a message every 5 seconds saying, that's painful, that's painful, that's painful. And that intensity gets higher and higher and higher. So before you're aware of it, you're aware of this pain in your toe that's been there, and it might be there for days, it even be there for weeks, and then it'll move on. So it's to do with the pain signals, being oversensitive, things that shouldn't be painful to the touch. Something like a hug for a person with fibromyalgia can be painful. Another thing I've come across is diagnosis. It's a wastebasket diagnosis. It's something they give you when you can't find any other causes. And again, that's just untrue because it's a genuine diagnosis in itself. A lot of people, their family, their friends just don't believe them that they're struggling as much as they are, or that it has such an impact on their life. So there's that dismissal from health professionals, because there's a lot of them that still tell you we don't believe in it, there's nothing we can do. Whereas just for someone with fibromyalgia, just having someone that believes them and that supports them can make such a difference.
Yeah, that's a very key message to our audience as well, that pain is actually invisible. So if somebody is experiencing that, it's hard to tell from the outside if they are, or like your own expectations or sort of misconceptions about what they are experiencing at that current moment. So yeah, thank you for also bringing that up as like the very key thing for our episodes as well. So I think we talked about your healthcare experiences slightly, with the diagnosis being quite long, and I guess, did any of the misconceptions or stigmas you've mentioned just now play a part in maybe the delay of your diagnosis, or do you think there were other things as well?
Oh, I think that very much played a part. I actually had to change GPs. I had a GP basically tell me I was a neurotic mother and to go home and get on with it. I walked out of surgery and never changed GPs after that. Still took me several years to actually get the diagnosis. But yeah, I've came across that several times where it's been, you go down, you might even go down to your GP with a new symptom, and it automatically you get told before they've even looked into it or checked it out, oh, it's part of your fibromyalgia, get used to it.
So
sometimes it might be, but it also could be another cause. So it's the fact that you're getting told it's fibromyalgia without them doing any investigation. I had a situation in the past where it was back pain, and I was just getting put down to just an aggravation of my normal back pain, and it turned out to be a kidney infection. So there can be things like that happen where things are missed because GPs are just dismissive of it. And it depends on the individual GP.
How can we as a community sort of educate ourselves better in terms of like fibromyalgia, so that maybe help with getting the diagnosis or treatment for it as well?
I think it's raising awareness. They say part of my job is quite often I'll go out and give awareness talks, awareness presentations, do things such as this on social media. So it's very much that, it's raising awareness of the condition and how it affects people differently, and how each person affects them individually. As a charity, we do a lot of awareness raising, not only with the public but also with the medical profession. And I think the more that happens, the better. Things like some of the daytime TV programmes and sort of morning breakfast programmes, they've had a few bits where they've spoken about fibromyalgia as part of the programme. So when you have things like that on the TV, articles in magazines, newspapers, all that really helps to get that sort of word out there about what fibromyalgia is, and to hopefully break down some of those stigmas and misconceptions.
Definitely. I think especially social media these days, if you post something more about, chronic pain, fibromyalgia, it's definitely going to get more attention, compared to maybe 20 years ago where social media wasn't that much of a thing. But yeah, so something like this would definitely help with getting some awareness about the condition. So there were a couple of methods that mentioned throughout the podcast on how to self-manage the symptoms and coping strategies. So I think you said about some medications and some self-management techniques, and also the hobbies that you talked about as well. Did you find any particular method more helpful than the other, or do you think like a collection of them is what works for you?
For me personally, it's a combination. As I say, it took me about 18 years to get a medication combination that actually made a difference. And it was from that, as I say, it doesn't take the pain away, but it reduces the intensity enough that I can function on a daily basis. I can do what I need to. I've got what I call my normal, which is nowhere near what I would have been without having fibromyalgia, but it lets me get done what I need to do and do the essential stuff and to live a fairly decent quality of life. So for me it was the medication, but it's all the, it's knowing that I've got other stuff that helps. Sometimes it might be things like I've got electric heat pads, so it might be sticking on my electric heat pad for an hour or two with the heat. It might be that I've been sitting and lying in one position, so I need to get up and move. I need to do some stretches and sort of ease off my muscles. I get restless legs along with my fibromyalgia, so when that happens, I've got a weighted blanket, and the weight of the blanket can help sort of minimise that. So it really depends on what the situation is, and how best to cope with it. I say use mindfulness a lot. I've had like CBT counselling over the years, and that helped me to sort of accept the limitations that having fibromyalgia and chronic pain has given me. And I think for myself that was also a big sort of turning point, because I realised that there wasn't going to be a magic pill that was going to take my pain away. Because I think at the beginning that's what we all want. We all want something to take the pain away. And through the sort of pain management programs and the counselling and the CBT, I realised that that's not going to happen, and it's accepting that no matter what I do, I'm going to be in pain, whether I do something or I don't do something. So it's like finding that balance as to what you can do without increasing your pain too badly or putting yourself into a flare, but also enjoying life. I still do things I enjoy. I still family days out, go to concerts, enjoy my hobbies, see my family and friends. So I still manage to do all those things.
That's really good to hear as well, that you're trying your best to maintain your normal life and just do whatever you want to do, really. Not make this a barrier for yourself. And some of our audience actually might think, as they're listening to our podcast, that they might think, oh, I have some similar symptoms or situations with chronic pain. So do you have any advice for people that may be struggling to get a diagnosis right now?
I think for a lot of people it's a case of having to persevere, and especially if they have a GP, it's quite dismissive. Often keeping a diary is quite a good idea. We often recommend sort of people keep a diary and just keeping a note of your sort of main symptoms, when they affect you, how they affect you, is there anything that helps, is there anything that makes it worse. That way, when you do go to speak to your GP, you're not just saying, well, I've got this pain, you're letting them see how it's affecting your full life and letting them see the impact of it. Sometimes it's a case of maybe, is there a different GP at your surgery that you can speak to? It might just be that one GP is just, you're getting nowhere, and the different GPs get a different outlook. Yeah, also maybe if someone come along to the appointment with you, if you find it difficult to express how you're feeling, having a family member, a good close friend that knows how it affects you, sometimes it's having that along. One of the misconceptions as well around diagnosis with fibromyalgia is it has to be done by a specialist, like a rheumatologist. And we see this week in, week out in our social media, in our online groups. People say, oh, get your doctor to refer you to a rheumatologist. Your doctor doesn't have to refer you, your GP can make that diagnosis. No need for a referral at all.
So if they want to get some support, maybe online or in person, where can they get in touch with, for example, FMA UK?
Yeah, we've got our website, which is www.fmauk.org. We're on social media, Facebook, Twitter, Instagram, X is Twitter, is now I keep forgetting that changed. So we're online. We've got a Facebook support group. We've got online support on a forum called Health Unlocked, which is a health forum. We've got online support there. We've got a national helpline where you can phone up and speak to a volunteer Monday to Friday between 10 and 4, and that's 0300 999 3333. To say, so you can phone up and speak to a volunteer about anything to do with fibromyalgia. We'll also help support a network of actual in-person support groups throughout the country. And again, contacting the charity, we can give you details of where your nearest support group is there one. And also, if there's not a group in your area and you feel that you could maybe start something, we offer support and help to sort of start.
And that nicely concludes our episode for today. Very much grateful for your time being here with us, sharing your experiences, and I think our audience would definitely get something from today's episode. So thank you so much for today, Hazel.
Thank you very much for the opportunity. To say, coming on to things like this is one of the best ways of raising awareness of the condition and sort of get the word out there.
And that's wrap for this episode by the Dysmenorrhea Project. We've learned lots about fibromyalgia, and hopefully this has increased your understanding and debunked any misconceptions related to this disease. The link to FMA UK, sources used, and links for further reading are listed in the description box. So please make sure to like and subscribe to our channel and follow our Instagram page for more future content regarding women's health topics. Looking forward to seeing you in our next episode.